Welcome back. The federal government designated May 11th as the official end of the COVID-19 health emergency. But the virus is still active and it's the leading cause of death in the United States among the elderly and immunocompromised. So it's important to take precautions like getting vaccinated and masking, especially if you have a compromised immune system. Here to talk about the reality of navigating post-pandemic life are Dr. Dorry Segev, director at NYU Center for Surgical and Transplant Applied Research, along with Advocate, Caregiver, and Board Chair Tracy. Thank you so much to both of you for being here.
Thank you for having this conversation with us.
Yes. Now, Doctor, let's start with you. With the federal public health emergency for COVID-19 expiring, how will that impact those with weakened immune systems?
Sure. Well, the public health emergency is done, but COVID is not. COVID is still causing trouble. 10,000 hospitalizations in the U.S. last week, a couple hundred deaths still every day from COVID. And those people who are immunocompromised are the ones who are getting the highest brunt of this impact. They now, without the protection of the public health emergency, with decreased testing, with decreased research into the new variants, et cetera, are facing new and complex questions about how to best protect themselves in light of all of this.
Wow. So what would you say is the number one thing we need to know about the current risk for COVID-19 among immunocompromised people?
So first of all, there are millions of people who are immunocompromised in this country. So we need to know that we're not talking about a handful of people, that everyone listening has somebody in their social network who's immunocompromised. Then we need to know that for those vulnerable folks, they have a higher risk of getting COVID. And if they get COVID, they have a higher risk of having a severe case of COVID with hospitalization, very bad long COVID, or even death from COVID. And so these are the vulnerable people all around us for whom we have to think about how we can best protect them. As their caregiver, obviously, I think about how to advise them as their doctor, but as a community, we need to come together and make sure that it's safe for those vulnerable among us to also resume their lives.
Yes, and Tracy, I want to ask you, how does this change how the immunocompromised community stays safe against new COVID-19 variants?
So Dr. Segev really pointed out the fact that it's millions of people, but it's really people we know, whether they've had an organ transplant, live with an autoimmune disease, are going through cancer treatment, or like me, my daughter was born with an incomplete immune system. So what's changed is that now folks are hyper vigilant or more vigilant because there are unknowns in testing, where the risks are and what to do. And that's why we're so delighted at the Immune Deficiency Foundation to have partnered with AstraZeneca on the Up the Antibodies campaign. It's a single resource that brings together all the most up-to-date information from the CDC about masking, about vaccines, patient stories, so that we can respect each other's need and desire to wear a mask as much as take care of each other. So share it with your patients, your caregivers, your families, friends, neighbors, coworkers. uptheantibodies.com, one resource for all the most timely and relevant information we need in the new age of COVID.
I love that. Thank you so much to both of you for being here. I want you to tell us one more time, Tracy, where we can go, where the immune-compromised community can go for more information.
It's the immune-compromised community, and everyone who knows them can go to uptheantibodies.com to learn more about managing in the new age of COVID.
I love it. Thank you so much to both of you for being here.